if the provider using general. So like that, any documentation we are receiving mean you have to use 23 modifier. If you are given the 23 modifier mean the insurance company will pay for the service, right? The example yesterday I am given, right? So dental procedure mean we use local, but the provider using general because the patient is psychiatry and then the patient is children baby. So because of this reason, if you are using 23 modifier mean that time the provider will getting the payment from insurance company. So this is for 23 modifier. And next one is the 47 modifier. So 47 modifier mean anesthesia by surgeon, right? So normally anesthesiologist only providing anesthesia to patient, but very rare scenario if the anesthesiologist is not there mean that time the provider given a surgeon will providing the anesthesia. So this is the concept, and mainly in this concept the zero series code along with 47 modifier they are mentioned in any option you have to eliminate that, right? If the provider given 47 modifier 47 modifier with the zero series code is there mean you have to eliminate because we are not coded 47 modifier along with anesthesia code. The reason anesthesiologist is involved there that time only we are using zero series, but in this scenario surgeon is involved so we are not using that. That's all, right? So these two modifier we are discussing yesterday, and today we have to discuss the HIPX modifier, guys, right? So we have 7 modifier. Guys, my request is in this HIPX modifier, if possible, you guys please prepare by own, right? Because yes, we already have in your book also in HIPX book, but in your exam point of view, if you guys prepared by own mean, we have to save time in your exam, right? So the 7 modifier is very important. And now if we are discussing now, you guys remember. So it's a easy thing only. So maximum prepared by own, it's good for your exam. Okay, one by one we'll discuss. The first modifier is the modifier AA. So please underline this, guys. This one will reflect it definitely in your exam. So the modifier AA. So what does this AA mean? Anesthesia service personally performed by anesthesiologist. Guys, clear? Anesthesia service personally performed by anesthesiologist. So you guys everyone know this is very common scenario, right? If any question, if the provider mention anesthesiologist personally performing anesthesia to patient, like that if you receiving any documentation, you guys directly use the modifier AA. That's all. You guys clear? Very simple, guys. Anesthesia service performed by anesthesiologist. Like that, any question if you are receiving, you have to use AA modifier. That's all. And next two modifier, AD and QK. Guys, in AD modifier, please underline the second line, guys. More than 4 concurrent. Please underline that. Right? In AD modifier, please underline more than 4 concurrent. Right? And the QK modifier, please underline 2, 3, 4 concurrent anesthesia procedure. Right? In AD modifier, please underline more than 4 concurrent procedure. And the QK modifier, please underline 2, 3, 4 concurrent anesthesia procedure. Because these two modifier having same concept. So these two modifier having same concept. Okay. So you guys, anyone having idea what is concurrent, guys? What is concurrent? Anyone having idea? Concurrent mean? Anyone? Okay. So concurrent mean continuous, guys. Right? So very simple. When we are using AD modifier mean anesthesiologist provide anesthesia. With the use of anesthesia, the provider perform continuously more than 4 procedure. That time we are using AD modifier. For example, the patient met severe accident. So the patient having fracture in 6 location. So anesthesiologist given anesthesia to patient. With the help of that anesthesia, continuously all the 6 procedure the provider perform. Now you are using the code AD modifier. You have to use AD modifier. So when we are using QK modifier mean 2, 3, 4 continuous procedure. Like if more than 4 mean AD, 4 less than 4 continuous procedure they perform mean you have to use QK modifier. That's all. Right? More than 4, 4 or less than 4. So based on the procedure you have to use. Because you guys know the patient having 6 location fracture mean one by one the provider will not do, right? Okay, 6 days we are planning for 6 procedure. It's not happen like that. Single anesthesia continuously the provider perform. So based on this only the code. So very simple guys. Once again I repeat, AD and QK. What does the difference mean? With the use of anesthesia, the provider perform more than 4 continuous procedure. You are using the code AD, and 4 or less than 4 procedure if they perform, you have to use QK modifier. That's all the difference. Guys clear? Okay. And then this 2 modifier is the optional only guys, right? It's not very much important, but you have to know what is AD, what is QK. Like that you have to know.
Thank you so much.
Next 3 modifier QY, QX, QZ. Guys, please note down these 3 modifier is called as CRNA modifier, guys. Can anyone tell me what is CRNA?
CRNA certified registers CRNA.
Right? QY, QX, QZ. This is CRNA modifier. Guys, anyone having idea what is CRNA?
Sir, CRNA working is under anesthesiologist.
Yes. Okay. So please note down, guys. CRNA mean, right? CRNA mean certified
Registered
right? CRNA mean certified, registered,
nurse.
certified, registered nurse anesthetist. Certified, registered nurse anesthetist. Right? So certified, registered nurse anesthetist. Actually, the CRNA mean what she said is right. They have to working under anesthesiologist. So the anesthesiologist, whatever the procedure or whatever the service they perform, the CRNA will helping to them. So the CRNA is not a doctor. They have to help for the anesthesia service. Sometimes the CRNA doing some of the small procedures also, like the small services, like A-line catheter removal, like that. The simple procedure also they're doing. So in these 3 modifier, if any procedure CRNA is performing in these 3 modifier, anyone we have to use. So what does the difference mean? If CRNA performing any service, either anesthesiologist or surgeon will be supervised, right? I hope you guys, everyone know what is meant by supervision. For example, if the CRNA doing the procedure mean in backside, the anesthesiologist will stand and they have to watch and they have to assist. That is called a supervision. So when we are using QI modifier mean medical direction of CRNA by anesthesiologist, right? Please underline anesthesiologist. The CRNA doing one procedure that is directed by anesthesiologist mean we are using the code QY modifier. So QY modifier. And next one QX is QX mean the medical direction of CRNA by physician. Physician means a surgeon. And the QZ mean sometimes both anesthesiologist and physician is very busy. So only the CRNA alone perform procedure. That time we are using QZ. So QY mean medical direction of CRNA by anesthesiologist. QX mean by physician. QZ mean without direction of physician. This is the three modifier for CRNA. Clear? Okay. So once again I repeat guys. The AA modifier mean if any question if you are receiving anesthesia service performed by anesthesiologist, like that if you are receiving any question, that time you have to use the modifier AA. And the next one ADQK, these two modifier, it's a combined. What does the difference mean? With the use of anesthesia, more than 4 anesthesia procedure performing, we are using AD. If 4 or less than 4 mean, you are using QK. That's all the difference. And next three modifier is CRNA modifier. QY, QX, QZ. QY mean anesthesiologist supervising CRNA service mean you have to use QY. And QX mean surgeon performing mean you are using QX. And then QZ mean the CRNA service without direction of physician. So this is the three. Okay, we have one more guideline guys. Please note down the guideline. Right? Okay. Okay. So please note down this guys. The concept is if someone is supervising, if someone is supervising CRNA service, if someone is supervising CRNA service, like that if you are receiving any question, right? You guys understand this question, right? Someone is supervising CRNA service. What does the meaning mean? In case in your question, anesthesiologist is supervised or surgeon is supervised, mean you guys easily quote. But the tricky word, they are using the term, someone is supervising. So, if guys are receiving the question like someone is supervising anesthesia service, sorry, CRNA service, like that if you are receiving mean, you guys please note down you have to use the modifier QX guys. So again I repeat, in case if the product documented someone is supervising CRNA service, like that if they document, you have to use the modifier QX. This one reflected in your assessment also guys. Right? Right? Okay. So someone mean you guys understand, right? So in your question they given someone is supervised, but they did not document who is it. If anesthesiologist or surgeon mean we code easily, but they did not document. So in that time, defaultly as per the guideline, we are using QX modifier. And the last one is the QS modifier, guys. The QS modifier is monitored anesthesia care. So yesterday we are discussing, right, in that first session, the MAC. If any question, the product documented MAC is performed. Monitor anesthesia care is performed. Like that, if anything is received mean, you have to use the modifier QX. Sorry, QS. That's all. So overall, the 7 modifier, you guys please underline QS and AA. AA modifier and QS modifier is very important. That's all about anesthesia modifier, guys. Clear? So you guys having any doubts on this modifier, guys? Is it everyone is clear? AA modifier, AD, QK, QY, QX, QZ and QS. So everyone is clear, right?
Yes,
Yes, sir.
sir. Excuse me,
Yes.
sir.
Yeah, tell me.
That is, if someone is supervising CRNA service, we have to use which modifier, sir?
QX.
X, sir. Okay.
Yes. Actually, we are considered as a physician only because comparing to anesthesiologist, surgeon only majority of time they have to supervise. So as per the guideline, defaultly we have to use QX.
Okay.
Right? Okay. So any other doubts, guys? Still now, whatever we're discussing, everything is clear.
Yes, sir.
Right? Okay. So that's all about anesthesia theory part, guys. So first we are discussing introduction of anesthesia and then types of anesthesia and then anesthesia included and excluded service and then anesthesia timing report, then anesthesia physical status, then anesthesia qualifying circumstance and then anesthesia modifier. So all these topics considered as the theoretical part of anesthesia. I hope you guys everyone is clear on this. So can I move to the coding part, guys? Is it everyone is clear? Right?
Yes, sir.
Okay. So now we have to enter into the coding. So I'm already informed. Hereafter, you guys, all the topic is coding only. In anesthesia only, we have the theory part. So we have to go one by one. So maximum today, after this session, I have to share the soft copy in your WhatsApp, guys, right? So the ICD book and then CPT and then HIPIX. All the 3 books soft copy I have to share in your group. You guys please download that and hereafter in your live session you have to use. In case you guys will not okay for PDF, if you guys want hard copy, which mean handbook mean, if you guys please message me personally, we have to share the courier also for the CPT because in these 3 books, this HIPIX and ICD is not needed because we have only minimal question, but CPT we have 64. So if you want mean, you guys will get the hard copy also, right? Okay, now we go to the coding part, guys. 1 minute. Okay, guys. So now we have to enter into the anesthesia coding part. So actually, guys, we have 3 books in coding, right? I hope you guys already know that. We have the ICD and CPT and HIPIX. So as per our discussion, the first we have to complete CPT only. So our major target is CPT. So hereafter, you guys will use only the CPT book only. So what you guys will do mean in your free time, you guys will do. You have to download the CPT book PDF. Whenever you have to open that, you guys having, I hope you guys know, we have 3000 pages. It's one of the biggest book, right? All the 3 book is big only. For the coding, whatever the books we are using, all the books having 3000, 6000, 5000 pages like that. But the book is not a matter. So how we have to use, this is the only thing. So if you open that PDF mean, you have to scroll down, right? For example, I will show you guys. You guys, everyone see the screen. So for example, if this is the CPT book mean, you have to scroll down. Scroll down, the first topic in your CPT book, the topic is comes under 99 series actually, right? So whenever you have to open the CPT book, the first topic in your CPT book, we are having the 99 codes. See, 9921 like that. So what is this 99 codes mean? This is for E&M code, right? So 99 series code mean this is for E&M codes. So this is the one topic, right? I hope you guys remember in our demo we discussed, right? We have the topic E&M like that. So this is a double line. So after completing the double line series, again you have to scroll down mean that time after the E&M, the next topic in your CPT book will comes under the anesthesia codes, guys. Right? All the E&M codes whenever completed, then we have to start the code 0 series. So please note down, guys. The heading is anesthesia. In bracket, please note down 0 series code. If any code start with 0, you have to consider as the anesthesia codes, right? Okay, right. Yes, you guys see the screen. After done that 9 series, is it visible, guys? The heading anesthesia. The heading is anesthesia, and the code start with 0000 like that. Guys, is it everyone is visible? The screen, guys, is it visible?
Yes, sir.
Okay. So this is the anesthesia codes, right? And one more thing, guys, for the CPT book, you guys don't have any leading method, right? You guys nothing have to do. You just one thing. All the CPT codes are alpha numerical codes only, right? Sorry, all the codes are numbers only. Like we have 5-digit number and mainly numbers only. So for example, 0, 1, 2, 3, 4, 5, 6, 7, 8, like that only. Whenever you have to use initially, that time you guys are facing some difficulties, but you guys will learn easily because hereafter for all the topic we are using this only, right? This book only we are using. So one by one, whenever you have to check, then you guys will remember all the thing. But main matter is you have to practice. That is very much important because in our live session I have to discuss mean definitely you guys everyone is understand only. But after completing the live session, I will give some of the homework question. So homework question without option only I'm given. So in this homework question, you guys will practice in daily purpose. So if you guys are frequently doing that mean, you guys will learn for your coding also, right? Because in starting I'm already informed, you guys will learn not only for exam, you have to learn for your coding. Maybe in future, if any company they will hire you and they given the book on code mean you will be able to code. That much knowledge you guys will gain. So my humble request, whatever the homework question I have to given, you guys please do that because all the batches, right, more than 5,000, 6,000 batches I done. In starting, everyone given response. After few days, whenever it will be go, they will not sending the answer. So definitely it will impact your knowledge, guys, right? So I will give the question only for your practice and your knowledge only. So you guys please take care. And one more thing is, whenever you have to practice frequently like this, then automatically you guys know how the CPT book is easy, everything. Because if you have any formula or if you have any leading method mean, okay, you have to learn that and you have to apply. But in the CPT book, you guys don't have any method actually. You have to do directly. Directly you have to check and you have to code. That's all. So by practice you have to learn, right? Okay, guys. So first thing I want to show you, right? This is a starting code for anesthesia. Before this code, if you guys scroll up mean, you guys see we have the qualifying circumstance. Yesterday we discussed, right? The qualifying circumstance. Yesterday I'm already informed. You guys no need to mug up. I will show you where is it given. Actually, anesthesia code starts with 0000. Before this code, if you guys scroll up mean, See, you guys having qualifying circumstance as well as, see, you guys having the physical status also. So maybe in your exam, if you guys are receiving this question, directly go to this page and you have to check and you have to code. That's all. Clear? Okay. So before starting the anesthesia coding part, I want to teach you one basic things, guys, right? Before that, you guys, anyone please read the description 00162, guys. What is 00162?
Radical surgery.
How to read the? Yes, it's a radical surgery, right? Okay. So can you please read 00176?
Radical surgery.
Radical surgery.
Okay. So this one also radical. Okay. So next one, how to read 00192?
Radical surgery. Radical surgery.
Radical surgery.
Okay. So three codes I'm asking. All the three code, it's a radical surgery, right? 00162 also radical. 00176 also radical. 00192 also radical. So now we are getting one confusion. Maybe in your exam, the provider perform radical surgery and all these options they given in your exam. So that time, which code we have to choose? Like that we are having one doubt, right? Okay. So guys, always remember, whenever you have to read any CPT code, first you have to read the primary code, along with you have to read the secondary code. For example, if you go with any interview, they given the book and they are asking how to read 00162. Like that they are asking. So 00162 is radical surgery. So you guys don't read directly, okay, radical surgery. Like that you guys don't do. What you have to do mean, you have to read primary code along with secondary, right? Okay, sir, I don't know what is primary code. I don't know. Very simple, guys. The 00162 mean if any code before that start with anesthesia for procedure, like that if anything is started, that is the primary code. So for example, 00162 is the before the code 160 is the primary code. See, anesthesia for procedure on nose and accessory sinus with radical surgery. So this is the method of reading. Okay, now you guys everyone read how to read 00176.
Excision of retrobranchial tumor.
No, 00176 now. How we have to read?
Excision of radical surgery.
No, guys. Actually, 00176 is the code, right? So, which is the primary code? Mean before that, you have to check which code start with anesthesia for. So, this is the primary code. So, if anybody reading 00176, mean you have to read anesthesia for intraoral procedure, including biopsy with radical surgery. So, this is the method. Guys, clear everyone? Okay.
Yes, sir.
Now, you guys read how to read 00192.
Anesthesia for
Anesthesia for procedure on facial bones or skull. Radical surgery.
Yes. You guys clear? So, anesthesia for procedure on facial bone or skull, radical surgery. That's all. Now you guys see what is the difference? This is for nose and accessory sinus radical surgery. This is for intraoral radical surgery. This is the facial bone radical surgery. That's all. Right? This is the common, guys. Hereafter, whenever you guys will do, that time you guys will understand. So the simple thing is, you have to read with the primary code along with secondary code you have to use. So this is a method you follow. But not only here, for entirely you have to read. And one more thing, this is only for reading. Whenever you have to read, you have to follow. But while coding, you code directly one code only, like 00176. That's all you have to code. So please note down, guys, the primary code and secondary code, we don't code together. Right? The primary code and secondary code, we don't code together. For example, if any exam question in option they given 00160, 162, like that, any question they given mean you have to eliminate that option, because only reading we have to read primary along with secondary, but one coding you have to code only the extensive one. Okay, now I will ask one by one, guys, right? So you guys tell me how to read, right? Okay. For example, who is first? Okay, so we will start with Afrin, right? So Afrin, can you please read how to read 00126, Afrin?
Anesthesia for procedure on external, middle, and inner ECG biopsy.
Okay.
Infantile.
Yes. Super. You guys clear? So whenever you have to read, this is the method. So anesthesia for procedure on external, middle, and inner ear, including biopsy with the tympanotomy. Okay. So this is the reading. While coding, which code alone you have to use, Afrin?
00126.
Yes, super. If any option 00120, 126 is there, can we use that option or we have to delete?
Delete.
Yes, that's all. Oh. Okay, next one is the Mahalakshmi. Mahalakshmi, you tell me how to read 00142 code.
Anesthesia for procedure on high lens surgery.
Yes. Clear? Anesthesia for procedure on eye with the lens surgery. Okay. While coding, which code alone you have to use?
00142.
Yes. If any option 140, 142 is there, mean can we use that option or we have to delete?
Delete, sir.
Yes. That's all. That's all, guys. Right? Okay. So next one, Mayuri, can you please try how to read 00147, Mayuri?
Anesthesia for procedures on eye, iridectomy.
Right? While coding, which code alone you are using?
00147 only.
Right? So Anuradha, how to read the code 0021 to Anuradha?
Anesthesia for intracranial procedures with subdural tabs.
Yes, super. While coding, which code alone you are using?
00212.
Yes. Guess everyone is clear, right? Okay, so Richa, can you please try how to read 00172, Richa?
Yes, sir. Anesthesia for intraoral procedure, including biopsy, and so 172, no, sir? Hello.
Yeah, 1200172.
Yeah, repeat again.
Yes.
Anesthesia for intraoral procedure, including biopsy, repair of
Yeah.
cleft palate.
Cleft palate.
Yes.
Yes, right. While coding, which code alone you are using?
00172.
Yeah, that's all. Now everyone is ready,
Yes.
right? I hope everyone is trying. So now you guys having knowledge how to read, how to code. Okay, this is the basic. That's why I said. Okay. Next we go for the coding. Actually, anesthesia coding is very easy, guys. The reason all the procedure you have to code based on the anatomical location, guys. Guys, clear? All the procedure you have to code based on the anatomical location. For example, you see the screen. First one we have the head location, and then we have neck location, then thorax, then intrathorax, and then abdomen, and then we have the extremities. All the anatomical location they given. Very simple. From head to foot and toe. All the location you guys having in these particular code sets. Very simple. How to code anesthesia mean the provider doing one procedure. First we have to check in which location the procedure is performed. So based on the location, you have to code. For example, I will tell you the provider documented I am performing electroconvulsive therapy. So this procedure performing in head location. You guys tell me which code you have electroconvulsive therapy. In this slide, answer.
Number 0104.
This is called as
00104.
direct leading question. So the direct answer 00104, right? So this is called as direct leading question, guys. Actually, in your CPC exam, 5 or 6 questions you guys are receiving direct leading only. So direct leading mean you have to read the question. If you're checking the question in option mean the same description they given. You no need to apply any concept guideline. Directly we are getting. So this type of question also you guys are receiving in your exam. Okay, why I am asking this one mean in this head location, all the questions are all the codes are direct leading only, right? So head location mean the code start with 0000 to 00222. I think you guys having 15 codes is there. So now what you guys will do mean, now I will give two question, guys, right? Now I will give two question. You guys everyone note down that question. After completing the session, you guys open your CPT book, go to the anesthesia heading, then head location. One by one the code you check. So which code will be suitable for that question? You have to send me the answer. So this is today homework question, right? So why, sir? In first session itself, you are given homework. Don't think like that. Actually, this head location, we don't have any concepts or guideline. If you guys checking the code, mean directly you are getting. So it's a direct only. You guys will try. It's very helpful for your knowledge, right? And one more thing, this question is exam question. So I will tell you if you are wrong the answer, I will tell you the correct one. So no need to worry about that, right? Can I give the question, guys? Everyone is ready,
Yes, sir.
Yes, sir.
right? Okay. So please note down the first question, guys. The first question is the patient have the patient have depressed skull
Sir, voice is breaking.
right? Again repeat. The patient have depressed skull fracture, depressed skull fracture. MD perform the patient have depressed skull fracture. MD perform cranioplasty, right? The patient have depressed skull fracture. MD perform cranioplasty for depressed skull fracture. Cranioplasty for depressed skull fracture. That's all, guys. So this is first question. Once again, I repeat the entire question, guys. The patient have depressed skull fracture. MD perform cranioplasty for depressed skull fracture. That's all. This is one question. And second question is the patient have brain hematoma. The patient have brain hematoma. The patient have brain hematoma. MD perform craniotomy with evacuation of brain hematoma, right? The patient having brain hematoma, MD perform craniotomy for evacuation of brain hematoma. That's all, guys. So this 2 question is your homework. After completing the session, you guys go through this and then give me the answer for that, right? Just to send the answer in my personal chat, right? If any wrong, I will tell you the correct one. That's all, guys. So just we are start anesthesia coding part. So the upcoming session, the continuation we have to discuss. Guys, clear? Right? And one more thing, guys, you guys have to go through one video, right? I have to share it upcoming session. What does that video mean? That is CPT book introduction. Actually, it's not needed for you guys because it's only for specialty coders. But for your knowledge purpose, right? You guys have to know in CPT book what are the things we have, and then what are the symbols we are using, and modifier where is it given. So prefix, suffix, like that. In the CPT book introduction, I am discussing on that particular video. My request, you guys just go through that, right? We are not getting any question or like that. You just go through that and you have to save in your mobile. After completing that, please don't delete, because some of the candidate they told after completing the training also, whenever they go for interview, they have to go through that video, because that video is very useful for coding interviews wherever. Because I'm discussing about the entire CPT book. What is a CPT book? What is given? What is the code? What are the codes they are given? Everything. So you guys please go through that. Maybe it is helpful for you guys also in your career, right? So upcoming session I have to share. You have to go through that. But today this 2 question is your homework. After the session, you guys check and send the answer. That's all, right? So happy weekend, guys. See you on coming session. Thank you, everyone. Good night, guys.
Thank you, sir.
Thank you, sir. Happy
Thank
weekend,
you,
sir.
everyone. Thank you, everyone. Good night, guys.